getting on the ride with their children. And others, it might be actually going out and going stand-up paddleboarding with your children, but to actively get involved and do those things that you'd love to be able to do as a family. And I've seen some incredible results from people who've come to me and they've said, I just want to be able to play with my kids and do those things that my kids are doing and be more actively involved. And there's one special memory that comes to mind for me, a fellow by the name of Tony Camilleri, who over time his whole family followed in his footsteps, and they all had gastric bands. This is quite a few years ago. And he was the soccer coach for his son's football team. But his real, the one thing that really got in his way was that he actually couldn't get involved and do it with him. And I saw him go on to compete in Ironman triathlons post-weight loss surgery. So from this drastic change of not actually being able to kick a ball, here he was doing Ironman triathlon. He started out doing a team event that I was involved with at the Noosa Triathlon, and just such a credit to him to use that as an opportunity to totally transform his life and to be so actively involved with his family. So just something to think about. Let me tell you a little bit about how tonight's going to look. I'm going to introduce you to our team, and one at a time they're going to actually come up here and share a little bit about their roles, what they do, what to expect for each of you when you actually come through our clinic. Kelly behind the desk, some of you may have spoken to before, here to help you along the way from an admin point of view. Erin is our accredited practicing dietitian. She's going to tell you all about how food relates to the various different procedures and what to expect from diet as well after surgery. Rebecca is our nurse, bariatric nurse. She's going to tell you all about the procedures, how they all work, how they function, and of course answer all of your questions. So please make tonight about yourselves, ask as many questions as you like, and hopefully you'll leave here really well informed about what your opportunities are for the future. We also have some very special guests who I will introduce you to later, patients who are going to share their own personal stories of their own success. Any questions before we go any further? Not yet. Okay, please do though, interrupt us whenever you like. That's what we're here for. All right, I'm going to start by introducing you to Rebecca to tell you all about the procedures. Please make her welcome.
Hi everyone, thanks for coming down tonight. I'm Rebecca, or Beck, as most people call me. I'm the nurse here at the clinic. So I'm going to raise some hands in the room who actually has kids. Yeah, and grown up kids, still got kids, everybody's a kid. A lot of the time when I have clients come into my office, the main reason why they want to do it is for their kids, be there for their kids in the long run. As a nurse, I am going to talk about the procedures, but I do really need to briefly touch base on diseases and how with obesity and weight gain, how they usually go hand in hand with other comorbidities. Things like blood pressure, high cholesterol, they all lead to the increased risk of having stroke. Diabetes is really common, sleep apnea, just not having the energy to get up and play with your kids. Not to mention the joint pain, the knee pain, the ankle pain, chronic pain, everything comes with that extra weight. The great thing about that though is that we've had so many clients who are sitting in the chairs that you're in now that have had things reversed, if not completely resolved, by simply losing weight. So that's just in a little bit of a nutshell that I like to touch on. But just starting off with the procedures, has everybody heard of the Obera, or what's commonly called as the balloon? Yeah? Raise your hands who's heard of it. Yep, so I've actually got one here. Oh, you can see it's very durable, it doesn't break or pop. Basically, the Obera is known as the balloon. It's called the intragastric balloon, and you'll actually see that it's in the middle here. So it's aimed for people that generally have a BMI of around about 27 to 28 and anything above that. It's really good for people that are after results for anywhere from about 10 to 15 kilo weight loss. And you'll find that it's really common with people who need to lose that weight before a joint procedure, whether you're having a knee or a hip operated on, it's got some really good success. So from that, it is the balloon. I'm going to pass it around just so you can feel it, have a hold of it. So the good thing about the balloon, which hasn't been around in the past, is it is only a procedure. You don't need an anaesthetic to have this inserted. It's just done through day surgery. You will go on a couple of days pre-diet just for other reasons, which the dietitian can go through with you. But basically what's used is, this is it, deflate it. You'll go under a light sedation. It's a sedation where you're not going to realise what's happening and you're not going to remember it, but you can obey commands. So basically you'll go in, let me just untangle it. This is it. So it gets fed through down to the stomach. Once it's in the stomach and the surgeons are happy where it's positioned, they'll inflate it. Now, the general inflation of the balloon is anywhere from 500 to 700 ml. And when you think about that, if you look at 2 sizes of Coke can, that's a large volume that can be in your stomach. So once it's inflated, they also inflate it with normal saline, so it's very safe. It can't cause any problems. They also put what's called a dye called methylene blue, which I'll describe why it goes in a little bit later. So once it's inflated and this is all removed out, you're left with the balloon sitting in the upper half of your stomach. You'll see on the diagram here just generally where it's positioned. It's positioned in there, and what it's designed to do is decrease the capacity of your stomach. So food's going to come in like it normally does. However, you're going to feel fuller quicker because you've got that decreased volume in your stomach. Food simply goes around the balloon and gets digested as it would normally. Okay. It's got very, very low risks associated with this procedure. One of the risks is that everything's not foolproof, and the manufacturers came up with a reason as to why we put that dye in. If the valve was to ever leak, or if it was to speak, or if anything was to happen, then your urine's actually going to turn fluorescent green. So if that was to ever occur, you simply call the clinic and we can advise you on the next step. So that's not a problem. Basically, as I said, it's day surgery. You'll go home that day. Generally, you'll have some common symptoms that you'll go home with. Things you could have nausea, there might be a little bit of cramping, and there might be a little bit of burning and reflux in the first couple of days. That doesn't last forever. It generally subsides within 3 to 5 days, and it's completely gone within 2 weeks. Now, we'll send you home with medications and instructions on what to do if any of those occur. The beauty of this is you can do anything with it. You'll be running, you'll be jumping. There's very low downtime. So you're really looking at probably about 3 to 4 days recovery. So you don't need to take too much time off work to have this one done either. Now, how long's the balloon in for? Does anybody know? 6 months, yeah, that's right. So we do put the balloon in for a 6-month period. Now that's very rare, it's non-negotiable, mainly because of the environment of the stomach being so acidic. The program isn't 6 months long, the program is 12 months long. What we want to do is we want to achieve lifestyle changes in that first 6 months. Then we remove the balloon. We want to make sure that those lifestyle changes that you've made are sustainable for the longevity. So you'll actually work really closely with following it. You'll see the nurse after you've had it done. And some of the questions that people ask, for example, a popular one is, what if it moves? Has anyone thought of that? Well, it's not going to come out. It might block it in, but it won't come out. Basically, you come in and you see me afterwards, and just in the room, I actually show you how to manipulate the balloon. If it does slightly move, you'll get signs that it has, and then it's just about simply doing it yourself. It's really, really easy. You don't need to come in to have it done, but we're here to help you if you want to. You will have really close input with our dietitian and our psychologist throughout the whole thing, just making all of those lifestyle changes. So has everyone had a chance to feel that balloon? Has it got to the back yet?
Yeah.
Yeah. Lovely. Does anyone have any questions on it? No?
So when it comes out,
yeah,
and they deflate it,
yeah. What do they do? They just
Yeah.
remove it.
Okay.
Yeah, so basically you go into that light sedation again.
The liquid comes out?
So yeah, they'll deflate it first because they definitely won't pull that
Yeah.
straight out. So they'll deflate the balloon and remove it, and then you go back to living as normal. Yeah. So I guess the biggest thing with it is that you really want to make those lifestyle changes and work closely with the tool and the team, because when it comes out, you can see that you're then going from that small amount of space in the stomach back to your original stomach again. So it can be very simple to go back to old habits, which is why during that 6-month phase, we really focus on making lifestyle changes.
So have you had patients that have done it again?
Yes, we have actually. Yeah, we've got some people that have gone to their second balloons. Yeah. So, for example, as I said, the average is 10 to 15 kilos. We have had some people that have lost 8 to 10, but we've actually had some really great success where clients have worked really well with the team. And they've lost a whopping 30 kilos. So it's really whatever you could commit yourself to, use the team that's here to help you, and you get great success. So any other questions on the balloon? No? All right. We will move on. Oh, actually, what I might quickly do, when I'm talking about weight loss, has anybody seen a piece of fat Yeah, so this is actually 2.25 kgs of fat. So if you're thinking of losing 10 to 15 kilos, you're going to lose 5 of those on average with the balloons. I'm actually going to pass that around just so you can have a feel and actually see how big that actually is. And that's only 2.25 kilo. I know, it's a bit mind-blowing, isn't it? Right. So while that goes around, I'm going to start talking about the band. Does anyone know a bit about the band? Yeah? So basically what happens, it is a surgical procedure now. It's done laparoscopically and does require a general anaesthetic. You're usually in hospital overnight. You do go on a 2-week pre-diet, which the dietitian can cover. The reason for that is your stomach, where it's positioned in your body, when you're holding excess weight, your liver is a very fatty organ. So it kind of overhangs over the top of the stomach. Now, because we're going in laparoscopically with tools and playing with the organs, by going on that 2-week diet plan, you're actually shrinking the liver and pulling it back raised over the stomach to give the surgeons best possible access and decrease complications while you're under the anaesthetic. So you go in. What happens is you actually it goes in, and you'll see on the diagram, it gets put around the top of the stomach. Now what it does, and it's designed to do, if you think about an hourglass, you've got a top section of the stomach, a little top section, and then the rest. Now when you digest food and it goes in like it normally does, what it does is it bounces around in that top little pouch. When it's bouncing around, it's actually sending all tiny hundreds of little messages to your brain, telling yourself you're full. So basically, you're getting satisfied on very small volumes of food. Then it simply makes its way through and digests as it normally would. So what happens is the surgeons go in with a few tools. You'll have 5 incisions over you. They wrap it up. They're very, very good at what they do, if you can imagine what they're doing. This gets wrapped around the stomach, gets tightened as such, gets all wrapped around, and then at this other end, it's called the port. So if you can see, I don't know if you can see down the back, but you can see how there's kind of all little bubbles that are around it. That's what allows us to either open it or close it and constrict the stomach as we need to. You've probably heard about adjustments when it comes to bands and things like that. How we do those adjustments is via the port. So the port's basically sitting under your skin and under your fat layer on top of your muscle, usually just off to this side. What happens is, one of the main things that we try to avoid is that you've got a foreign object in your body and we don't touch it for 6 weeks after it's been put in. Generally speaking, this is enough to go and shock the stomach when it first goes in, and we don't want to access it because we want to decrease infection rates. We have fantastic infection rates here. I haven't seen any, and the nurse before me said that they were just wonderful, so that's really good news. So what happens is you come in 4 to 6 weeks after you've had it all fitted in, all's well and good, and we start inflating the balloons. What we refer to with the band, which is the key to everything, and you'll hear it over and over and over again, is the green zone. Basically, if we can get you to the green zone safely and quickly, that's where you'll lose your optimal weight. Now, we don't refer to the green zone as, oh, I've got 6 mils in my band, I've got 8 mils in mine. It's not about the volume. It's about how the tool's working for you and how you're working with the tool. It's a 50-50 counterpart. You both need to work together to get the optimal result. So what happens is once we're in that green zone, we're basically going to be looking at aiming to lose anywhere from 2 to 4 kilos a month. So it's pretty good once you get to that green zone. Now, it's not difficult to get to the green zone. You might have to have a couple of regular adjustments at the start, but all that means is I can actually do them here in my room. So you don't have to go off to the specialist or anything like that. We adjust it as per how the tool's working for you. Again, it comes with following any procedure. It'll have a specific diet plan and things like that. You can't just have this in and then go straight to Holt's Breath and have a steak and chips meal. And you'll get a special thing as to what you can have. But a few things you will be restricted to. A couple of foods that you once ate, you won't be able to eat, or the volume at least. White bread in particular, it's one that really, really swells. You can imagine what could happen if you're having a large piece of white bread and that swells in the top. You're going to get that burn, possibly regurgitation. So that's just some of the signs of how to work with you. So I always say work with the team. We can let you know what's going to happen. We can let you know. We'll educate you with all the steps along the way. The dietitian's fantastic and will give you all of the plans that you need. other beauty of the band, any complication is reversible. Okay. Main two complications with the band is that you can have a slippage. Has anyone heard of the slippage? Anyone tell me what the slippage is? No?
It just moves.
That's exactly right. So the band, to get it worked optimally, it sits at a specific angle, and that's where the surgeons put it in. When they put it in, they put a little, basically pull a bit of skin from here and stitch it up here. That locks it in place. Now, some don't have that, and for some unknown reason, sometimes the band can slip. Now, you will have warning signs when the band does slip. You'll get things maybe like a little bit of pain, regurgitation, a bit of reflux. All it means is that you come in, we might just, if we get it early enough, it might be a matter of just removing the fluid, letting the stomach relax a little bit, and then we'll be fine again. Because, or what'll happen, the other, so that's the slip. Otherwise, we send you for a swallow and we can rectify it. It comes out, gets redone. So everything's reversible. The other thing is called an erosion. Now, it's pretty much exactly what the name suggests. This rubbing on the outside of the stomach can cause the holes from the outside. Now, these are they're not common things that happen all the time, but they could happen, but the beauty is they're completely reversible. Okay. Does anybody have any questions on the band? No? I must be doing a really good presentation, or you just don't have any questions. All right, so one of the most popular ones that we talk about these days, and we're seeing more and more interest in it, is the sleeve. Who has heard about the sleeve? Yeah, who's interested in the sleeve? Yeah, so, and basically what we're doing, if we want to look at it, general anaesthetic, but basically major surgery. I like to describe it to clients as we're basically doing an internal renovation of your digestive system. What we're going to do is you'll go under a general anaesthetic. You're usually looking at 2 nights in hospital just to make sure that everything's okay, home on day 3. You do the pre-fasting, or not fasting, but the pre-diet beforehand, shrink that liver out of the way to increase any complications or things that could happen with the liver. The doctors go in, mainly through the site down here, and they cut away 2/3 of your stomach. Now, when they cut away that 2/3 of the stomach, that part gets removed, and they use titanium staples, Teflon, and a little bit of sealing to seal and heal. So they cover it up. Now, can everyone just put their fingers together like that? 2 fingers together, that's the new width of your stomach. Okay, so I like people to actually go, wow, that's it. You're going from a lot of people actually look at that and go, really? But yeah, unless you've got, so that's basically what happens. So it's big lifestyle changes too. So things like eating and drinking at the same time, it changes. The average size meal that you're eating now, you'll probably never be able to eat again. But it's like a handbrake, I like to say. It stops you from eating excessively. It's small amounts. Basically with the sleeve, lost my train of thought there. Sorry, what was that? I've just lost my train of thought with the sleeve.
What part were you up to?
I was talking about, no, I'm fine. It's all good.
Okay.
So basically, does anyone have any questions about the sleeve?
What if that's what it will be? What in fingers terms is it now?
Yep. Is it now?
Yeah.
Well, I guess it all depends on.
Well, rough average.
Well, they say the average size is a fist, but generally speaking, it's an elastic organ, so it's stretching as much as it needs to as to what you're putting into it at the moment. So some of the biggest risk factor with a sleeve is basically a leak or a bleed. So those two could potentially happen. Now the leak basically means exactly what the name suggests, is there's a leak along the new seam of your stomach. Now we do put you on a very, very strict plan post having a sleeve, and you actually don't get back to eating textured foods for around about 6 weeks. You go on basically 2 weeks through a straw, 2 weeks of puree, 2 weeks of soggy, and then when you get the all clear from the dietitian and everyone else, you can go back to eating a meal. After 12 months, you'll generally start eating entree size. So, as I said, the risk is the leak. Other 3 things that people have commonly said that they get after having the sleeve, there's 3 things. It's shoulder pain. So a lot of people will come out and they'll go, what on earth did you do to my shoulder? Well, we didn't touch your shoulder. It's actually when we've gone in and we've filled you up with gas and we've done the surgery, we fill you up with carbon dioxide. So basically that has to escape somehow. So how it does that is you've got the diaphragm here that divides your abdomen through your lungs and heart. Now, the only way it can get out is to actually go up through there, in particular through your right shoulder. So some people never get it, they don't get it. Some people get it really bad. All we can encourage you to do is get up and be moving, even if it's moving around in bed, just to get rid of that feeling. Another thing also is some people will say they just feel like they've got their finger and it's just pushing and it just feels like it just won't let go. That's purely because it's just amount of time for the scar tissue to develop. Because it's such a narrow stomach that we're leaving in, the surgeons will sometimes just stitch it in just so it doesn't roll on itself and things like that. So weight loss is rapid. Really, again, how you want to work with the tool. Comparing the band and the sleeve together, research does indicate that over a 2-year period that weight loss is very similar. It's just that with the sleeve it's quite rapid, with the band it takes that little bit longer to get there, but you get there in the end. Any questions?
What's the downtime for the sleeve?
Look, you're looking at I'd say on a minimum of a week, if you can 2 weeks. Only in that first week you're really going to feel you've had major surgery. So that's the one thing. The one good thing about being laparoscopic is that you are back up on your feet quickly, and a week off work can actually be achievable. But keeping in mind that even though you're back up on your feet and going, it's still major surgery to an internal organ.
So if they were to discover a leak,
yeah,
how do they go and fix it back the way they did?
Yeah, so ideally, you'd like to hope that there was some way that you could oversew, but if that's not possible, that's when you start looking at bringing bowel up and changing things around. So yeah.
We've never had to do that.
No, exactly. We've never ever had to do that, but if it had to happen, that's what would happen.
But you've had leaks?
No, not that I can recall.
Nothing that hasn't been, actually our complication rate is less than the national average of 1%. So we're fairly proud of our complication factor. The national average would be about 1%, would be an acceptable complication rate. But in this clinic, it is way less than that. In fact, one of the patients you're going to hear from tonight did have a bit of a complication. So, you'll get to hear the warts and all stories tonight.
So with the gastric sleeve, you could never stretch your stomach again,
The stomach is made of like elastic tissue, so you're not going to overstretch it because there's not a lot there.
Yeah.
But of course, it's not going to stay rigid forever. It's going to get its movement back, and you have the potential of it getting bigger. Yes, yeah. If you're not using the tool appropriately.
Do the staples just stay there forever?
I'm sure they are. They just stay in. Yeah. They just heal and seal it. All of your wound sites though, you've got no stitches. It's all just waterproof dressings. Everything's dissolvable, so there's no issues with that at all.
Is that 5 keyhole?
Yeah, both are keyhole. Band and sleeve are both done keyhole.
So they have the five
sides. Yeah.
And can it last forever?
Yeah, forever. You'll actually find a lot of the people that get a band, they refer to the band as their friend. Most people wouldn't let you take it out, only because it fits with life. If like we've had some people that've gone away on overseas holidays, or they want to go to their child's wedding or something like that. As we all do, we tend to maybe overindulge for that particular day. You can come in, we can reduce it so you can enjoy yourself. You get back, we put the restrictions back in place to get back on track. So that's the other thing, it can really fit with life.
Maybe we'll keep questions for after, but Beck will be here afterwards, so you're more than welcome to ask her specific questions as well afterwards. Thank you so much. Probably one of the things I'd like to touch on is, comorbidities. What do we see in this clinic? One of the most significant reasons that Beck touched on right at the beginning of her presentation is the medical reasons that we actually manage and treat patients surgically for morbid obesity. And the top ones that we see would definitely be type 2 diabetes. I can't underestimate the impact of type 2 diabetes and the number of patients that we see who are either pre-diabetic, already on type 2 diabetes medication, or their medication's just been increased and they're just over that, and they also become aware of all the ongoing other associated complications that go hand in hand with type 2. Not to be underestimated, the cardiovascular disease risk and all the other associated complications. So it's really important to talk about those things, and these are the kinds of things that we get to share in the resolution of and the change in medication control, even at 5 and 7 weeks after surgery, especially with the sleeve gastrectomy. we're seeing patients come back and they're already off a host of medications, sometimes up to 5 medications that patients are already off at 5 weeks after surgery. So it's incredible. It's such a powerful situation to consider that this is the change in medical conditions that surgery has the opportunity to treat and manage in patients. Where 96% of diets and exercise alone have failed in the past, because that's the actual statistic, that surgery in combination with a lifestyle program, when it is really well implemented and consistent, is going to bring you long-term outcomes and long-term results. And when we look at the fact that this team in particular offers you an unlimited 12-month aftercare program, there's a really good reason for that. First of all, this clinic has actually been involved in the very first research on does follow-up attendance equate to better long-term outcomes in patients. We presented that research. Can I get you a glass of water? No, don't apologise. Would you like some water?
It'll be good.
Yeah, absolutely.
Sorry.
No, don't apologise at all. One of those. How many bugs going around? Thank for me. Anyone else need a glass of water while I'm there? You've actually got bottles of water in your bags too. Yeah, cool. Hope that helps.
Thank you.
Yeah, so just back to the team and the impact of having an ongoing and consistent dedicated approach to aftercare. So the research that we actually presented was first presented in around about 2004 in Boston at the American Bariatric Surgical Meeting. So, and since then has actually been extended in other clinics around the world to look at, what is the impact of the aftercare? Why is it so important? Surgery is one day in your life. It's the aftercare that's critical. And we know that with a lifestyle modification program where we're committed to working with you and when you're committed to working with the team, you're going to get the long-term outcomes. So our vision is not just about weight loss and where you're going to be in 12 months. It's very much about where are you going to be in 5 years, where are you going to be in 10 years, and where are you going to be in 30 years. And for me personally, I've got a really strong vision about keeping people out of nursing homes. We want you to live an independent, functional life for the rest of your life. And that means for us that you're active, fit, healthy, and self-sufficient. So these are some of the outcomes that we hope you're going to achieve with bariatric surgery and be able to play with your kids and your grandchildren or all those other positive lifestyle, outcomes. Yeah, just a little bit of information from me. All right, so after you've seen the nurse, there are other team members that you're going to consult with, and one of them is a psychologist. Unfortunately, tonight we have 2 psychologists on our team. One is tonight celebrating her very first wedding anniversary with her husband. They've been together for 8 years and have 2 gorgeous children, but they've only been married for a year, and tonight just happens to be their wedding anniversary. And the other one, so that's Kerry. She's absolutely gorgeous, clinical psychologist with a lot of experience in this area. And the other one, Warren, he happens to be down with, am I allowed to say man flu? But he's, doctor's orders, still in bed, and we've got him a full day of consulting tomorrow, so we've got to keep him well and not coughing in front of a group of people so that he can actually consult all day tomorrow. So we're hoping that he's going to be well and capable of looking after all those people who've travelled from a long distance, especially patients from Mount Isa tomorrow. So I just want to share with you, why is it so important to have a psychologist team member? Years ago, people used to say to me, oh, do I have to see the psychologist? Why do I have to see the psychologist? And there was a real strong, resistance to wanting to get involved in seeing a psychologist. I think we've converted people to understand that there is so much value. The first thing that the psychologist is going to do when you actually come and see them for your initial consultation is really look at your goals and expectations. Are we matching up the best procedure for each individual patient? And is that going to deliver what they're looking for? So that's really important. That's the first thing that we look at. We've got options available. Is the sleeve going to be right for you, for example? Why? Based on so many different criteria. So that's important. Getting to know you is really important. And also explaining to you what is going to happen for the next 12 months when you come and see a psychologist. So just say, for example, if you've been an emotional eater, does anyone here identify with the trigger or the downfall that you're an emotional eater, that's part of the profile? Yes? So, really after surgery, it is still only one day in your life. But we want to make sure that those triggers, barriers, whatever they are, that they're not going to be there consistently in the future. And we're looking at strategies and how are we going to deal with that so that you never fall into that trap in the future. That's part of it. So many changes that you go through in the first 12 months in terms of self-esteem, self-awareness, body image. All of those things are your opportunity to work on with a psychologist over 12 months. I had a lady in here recently, a nurse, who's lost 40 kilos after the sleeve gastrectomy. I think she's about 10 months post-surgery. And she said to me she was walking through a shopping centre and caught sight of someone that she saw, and she thought, oh, that's a really attractive lady. She looks lovely. And then she actually had to do a double take because she was looking at her own self-reflection. So, it's amazing how dealing with those changes, positive and negative, sometimes you actually need the opportunity to work through that with the support of a psychologist. So in this program, you have unlimited access to work with your team members. And that means, in the beginning, early phases, it might be every week that you're on the phone, on Skype, or here in the clinic with the psychologist or the dietitian. So, that can change over time too. It's very individual, but that's your opportunity. Any questions about the psychologist's role? Because I hopefully can answer for you.
So do they make an assessment that you're mentally okay to have, is
It's not so much a psychological assessment, but there's been situations where, for example, if you've got a bipolar patient, you've got to make sure that they've got the right support and infrastructure around them to manage a procedure, for example. You don't want anyone to fall into any cracks. So they've got to look at all the different psychological profiles of patients, and making sure that support is there is the critical thing. So awareness and support are the key factors there.
So they're not there to make a judgment to say, I think you're doing it for the wrong reason, or?
Not at all, not at all. They're there to actually provide support.
Okay.
Support, encouragement, advice, and to be a bit of a life coach as well. But, we're talking about, these are clinically trained clinical psychologists who have the skills to support you throughout that 12-month process. So, yeah, they're both fantastic team members, and when you have the opportunity to meet with them, I encourage you to make the most of that opportunity and work with them. All right. Any other questions about the psychologist's role? So often I think the guys like to work with Warren. I think it's an advantage to have two psychologists in the team. Often the girls like to work with Kerry and the guys with Warren, but not always. But that's also such an advantage within this clinic that you've got a choice there. So I think we're really lucky and very fortunate to have both of them. Yeah, question?
I just wanted to mention that there is a patient online.
Mm-hmm.
And they had surgery a week ago, and they just put into the chat that they lost 9 kilo in their first week post-surgery.
Wow, I think I know who that is.
Yeah,
What surgery did they have?
Is that Liz?
That's Liz. Yeah.
Liz, hello. She had the sleeve gastrectomy. She's doing really, really well. I think she lives quite a distance from the clinic, so can't always access us, but if she wants to ask a question, we're really quick on Facebook too. So private messages get to us in a flash, and we're always there to answer them. Yeah, awesome. All right, so hopefully I've given you a little bit of a feeling for what's involved with a psychologist and what the opportunity is to work with them. The next team member I would like to introduce to you tonight is our dietitian. Really important and significant team member. Sorry, before I do that, I just wanted to mention one thing, just touching back on the psychologist for a second. I'm not sure if you're aware that today is a day that's been labelled Are You OK Day? And I'm sure our psychologists, had either of them been here tonight, would have raised that. And, obviously anxiety, depression, self-esteem issues are all part of the profile of what we see here every day. But the resolution of those issues as part of the comorbid profile of a patient are so improved post-surgery. It's actually phenomenal to actually imagine it, how far patients come with that part of the being overweight and obese, and the improvements are drastic. So just wanted to mention that, and just alert that Are You OK Day. It's important to ask people close to you if they're okay. All right, Erin is our dietitian, awesome team member, an absolute wealth of knowledge and so much to share that you'll learn from her when you have the opportunity. Please make her welcome.
Hello everyone, good evening. It's really exciting to see the room so full. That's really fantastic. And hi to everybody who is playing along at home. I guess my role in this team as dietitian isn't to be somebody who slaps you on the wrist and polices your food and restricts the joy of life for you. My role is really about really helping you engage in a positive way with food, and I guess, you know, having food be your friend. Something that I believe in so much is that, you know, food is so important for us, not only for our nutrition, everyday life and functioning. I think our relationship with food is such a crucial part of our lives and such a crucial part of our happiness and how we view ourselves and how happy we are with ourselves. And it's really important to me that everybody who walks through this door participates in any one of our programs. I really want them to leave not only after, I guess, the program, but I would like for them to leave a consultation with me at least improving their outlook or their relationship with food and how they, I guess, view that with their own body image. Who here feels that their relationship with food could improve a little bit? A lot? Yeah. Who's scared of food? In a way. Feels like maybe it's the enemy. It's a bit of a love-hate relationship. A little bit, yes and no. Yeah, so these are the things that I guess, you know, we really want to work on, because working on how you relate to food, how you feel about it is really going to be such an important thing for your long-term success. And that's what we're about here. You know, we don't want to just get weighed down really quickly and then off you go. We really want to be able to give you the tools, give you the knowledge to be able to carry this on successfully for the rest of your life. So that's a really important part of not only engaging with me, but the rest of the team. We all work together because that's so important to all of us. Now, what I might touch on first is, I guess, what to expect when you see the dietitian for your very first consultation. Now, it's not necessarily going to be an assessment of, you know, all the things and all the choices that maybe we could have made better choices. She's going to just stand there and judge me and tell me that I eat bad foods. It's nothing like that at all. I'm actually a very nice person. I'm really not very judgmental. That's not always the perception of dietitians though. But what we really want to do in the very first consultation and meeting that we have together, either just by yourself, a lot of people bring their family as well, is we want to look at, okay, what are maybe some eating patterns, some eating behaviours that are holding us back from being as happy as what we could be? What are the things that after our recovery from our balloon insertion or our surgery do we want to work on to make sure that we can continue to be the healthiest and happiest version of ourselves? That's really what we want to achieve here. So like Beck, I might actually start with the Orbira, the gastric balloon, which I think, did everybody have a little feel of that? So that balloon that went around is actually half deflated. It's even more inflated than that when it's inside of you. And the first time I saw that, that just blew my mind. I just thought, wow, that's incredible. That's such a, you know, we've come such a long way with weight loss options. So basically what we want to do, because like Rebecca's explained, it's not actually a surgical procedure. So for some people, that's going to be a really big deal. A lot of people, you know, that step to surgery is maybe not necessarily appropriate or right for them. So this is actually a temporary non-surgical option, and I think it's just such a fantastic thing. So basically, like Beck said, the balloon is inserted by an endoscope, and then it is inflated and the endoscope is removed. So what we want to achieve, I guess, in terms of our diet to prepare for something like a balloon insertion is we want to make sure that the stomach is nice and flushed out. So we will go on a fluid diet for the first 3 days before the balloon's put in, which I go through in a lot more detail in an Orbira consultation. And so what we do is we want to make sure that the stomach is nice and flushed of any residues or, you know, any bits and pieces that might be in there. And the reason for that is because we want to make sure that we're not going to pull anything up the throat or put anything into the lungs. It's never happened in the time I've been here. It's a very, very rare complication, but we go to any length that we need to ensure your safety. And so that's why I guess adhering to the pre-operative phase and post-operative phase is a really, really important part of your program. So that's really it. 3 days of fluids. It's almost a bit like preparing for a colonoscopy, really. You get the clear fluid day right before it goes in, and then it's nil by mouth. As soon as you, I guess, sort of come around from your light anaesthetic, which you'll be awake and aware, well, you'll be awake but not really aware of what's going on. So you'll be a bit in la la land. So there's no cameras in the room. So just because so basically you'll sort of come around from that after. You might be a bit tired and you might still feel a bit funny in the head, but very, very quick recovery from that. And then basically what we start you on is we start you sort of in the reverse. We start with some clear fluids and see how we go with that. Now, the 6-week, I guess, recovery phase for all the programs we offer here at this clinic, they're now all identical. It didn't used to be the case with the Orbera. We used to basically get people tolerating fluids and then it was back to food as soon as possible. We've actually adapted a 6-week recovery phase that's the same for the band and for the sleeve, because what we found was that people had much better long-term success. And the reason for that is because if we think, you know, the balloon is sitting in the upper part of the stomach, we have a very small space above it. So what the stomach needs to get used to doing is manipulating foods and fluids around the balloon. So you may feel a little bit off color the first 48 hours, just because your stomach's not used to being able to not push something through the system. You can get a bit of cramping because your stomach's sort of thinking, well, what's going on? Why is this not going down? Gets used to it very quickly. But the first 48 hours can be a bit intense. Some people have no issues at all. Some people have a bit of nausea, but it's all very normal considering that you've got that balloon sort of sitting there. So what we do is we go on to a full fluid diet after that. And that's basically because we need to get the stomach used to gently pushing some fluids around that balloon. After 2 weeks of that, we grade up to some purees, which is a bit thicker again. And we get used to pushing something of a bit more substance around that balloon. Then we move up to what we call soft foods. And all of this we go through in a lot of detail during a consultation as to sort of what's in and what's out, because it can be a bit overwhelming sometimes. But after 2 weeks of soft, that's when we start to look at, okay, we're going to start introducing basically all textured foods back in. But at that point, at that 6-week point, is where we look at, all right, so we're coping well with the balloon, everything's moving around it nicely, I'm getting used to how much I can sort of generally fit in at a time without feeling like I've overdone it. And it's at that point when we've really recovered that we start looking at, what do I want to change about how I was eating before, and what are we going to work on, what strategies are we going to come up with to I guess, to change the future. What do I want to learn now in this 6 months when I've got this restriction as to how much I can eat? What do I want to learn? That's not a real alarm, but a bit. Basically, what do I want to learn that's going to take me forward into the future, so that when that balloon is taken out, I'm going to be okay. Now, a lot of people sort of think, okay, well, when the balloon's taken out, am I just going to go back to being hungry and starving again? Which makes a lot of sense. But basically, if we're working together, and if we're using this balloon tool right in that 6 months while it's in, what we generally tend to see is that the balloon comes out. And with the techniques that Rebecca explained, it's basically just taken out, deflated, taken out the exact same way. We go into the exact same preparation fluid diet, only with 2 days of clear fluid. But basically, when that balloon is taken out, because you've had that 6 months of getting used to an adjusted portion size, your body's been getting used to I guess, processing a certain amount of nutrition, and your body's functioning very well off of that nutrition, it's very rare that we see somebody get the same level of hunger as what they once were. Now, I guess like anything, we could manipulate that. And if you really, really pushed hard in the first couple of weeks after having your balloon taken out and went and, really hit the pizzas hard or the ice cream, yes, like anything, you can reverse all of that work that you've done. But part of the program is that, I'm it's very rare that we have somebody who wants to do that. And B, if we're worried about those kinds of things sort of coming back into our habits, that's where we've got the rest of that 6 months together to really work on those things. So that's probably the main question I get about the balloon is, am I going to just go back to feeling hungry, and what's the point of having it in for 6 months? I guess the point is that this is a temporary option to really sort of get someone back on track, if that makes sense. Does anyone have any questions about the balloon in terms of eating, drinking, how it all works? No, not really? Excellent. If anybody online has questions, please throw them at me as well. So what I might move on to next is the gastric band. Now, our preparation, I might sort of talk about the band and the sleeve a bit together, because the preparation for both of them is identical. So we need a bit more of a preparation phase for this one, because it is an actual surgery. So like Rebecca explained, we have our liver, which is actually a very big organ, our liver, and it sits and sort of wraps around the stomach area. And because our surgeon is so brilliant, he can do all of these surgeries via keyhole, and he can actually do them very quickly, and his skill is brilliant. One of the things that we really need to do to I guess, give the surgeon the best access possible and make this procedure, I guess, the safest and smoothest for you possible, is that we need to reduce the volume and the size of the liver, because we actually have to sort of lift it up and move it out of the way so that we can get direct access to that stomach. So we go on to a 2-week preoperative diet. And it is not focused on weight loss. Most people do actually lose a fair bit of weight with this preoperative phase, but what I'm really looking at is the effect that it's going to have on your liver. And basically what we want to see is you going onto a specific calorie controlled diet that is going to reduce that liver volume, so that your surgery is going to be as safe as it can possibly be. So the 2-week preoperative diet is what we call a VLCD. Who has heard of that or seen that? One person? Yes. Do you know, can you explain it? Do you know generally?
Very low calorie diet.
Yep, very low calorie diet or very low calorie drink. Does anybody know generally what that means? Usually the shakes. Who here in this room has tried shake diets? Yeah, a few people. How successful long-term did you feel they were? Not very. Okay. Now the shake diets are, I guess, such an industry at the moment. I think every celebrity has a shake, and they're left, right, and centre in chemists and in supermarkets. They're sort of popping up at us all over the place. Now, the VLCD, they actually originated as a hospital-only food or a medically supervised diet. So I guess it was Optifast that was sort of widely used in Australia. That actually originated for people who needed to have heart surgery or major surgery, and they needed to reduce the fat around their organs so that the surgeon could successfully perform the operation. So they were actually intended for people who were bedridden and not really feeling very well at all. So when we sort of think that now, these VLCDs have come to a place where the packet's recommending that you use it for 8 weeks, the reason why you maybe don't feel 100% is that you're not a bedridden, very sick, hospitalized person. So this is why a lot of people say, I found it so hard to stick to. It was so restrictive, and the reason is that you're trying to follow something that somebody would be following if they were sleeping 20 hours out of the day, and most people don't have an occupation that really allows for that. So that's sort of where people go, I feel like I've tried all these shakes and I've just failed, but really they're sort of designed to fail you, because we've taken something that originated as medically supervised only, and we've really marketed it to be something that people sort of bounce back and forward from, because you lose weight, you go off the shakes, you gain weight, you come back to the shakes. So it's really quite a negative cycle. And the reason I just wanted to explain that and give that little bit of information is because whenever I go, okay, we're having a sleeve or we're having a band, we have to follow a VLCD, I get a few shocked looks and go, oh no, I've done those and they were horrible and it was so restrictive and I hated it and I felt ill and I couldn't work, and I get quite a mixed reaction. And so what I really want to point out is that we are doing something that is going to be a benefit to you surgically, and that is actually a surgical standard, not only for bariatric surgery, but for many other surgeries. And we're doing it in a way that keeps you out of having to do that in hospital. So what we do is we go on to a chosen VLCD. Now everybody has different choices. Everybody likes different flavors, different shakes. So generally, you know, it really is up to you as to what you choose. We have a few options here in this clinic, and our team are really, really good at, you know, at helping you with those as well. So don't feel that you're sort of on your own. There's definitely people here that can help you with choosing a VLCD. And so basically we follow that for 2 weeks. There's also some different fruits, vegetables, etc., that are suitable on a VLCD. Now, I guess this is different to sort of a protein drink we might go on if we were sort of going to the gym, or sort of the general sort of protein you might add to a breakfast drink. The reason it has to be, I guess, a dietitian's specified VLCD product is because there's going to be certain elements of nutrition within that drink that is going to help support your liver function and support your metabolism in order to get that liver down. So this is why it's important, you know, to really engage with the team before your surgery to make sure you've got all those boxes checked and that you're on the right track. The first 2 weeks can be the toughest because you've still got your full stomach capacity there. So a lot of the time people sort of say until they hit day 3, they're feeling a bit hungry and a bit flat, but generally it's only 2 weeks, and it's, you know, we tend to think of it as, you know, it's 2 weeks preparing for the rest of your life. You can do anything for 2 weeks. Most things you can do for 2 weeks. The VLCD is one of them. So then we have our surgery, and you know, you'll be in hospital for generally 48 hours. After your surgery, I guess, you know, particularly we see a lot of sleeves, so I'll sort of focus a bit more specifically on that. After you've had your surgery done, you'll be brought maybe some clear fluids in the hospital, delicious things like salty water that they call soup, but you'll be brought maybe some juice, some tea, some very basic clear fluids, just to see how you tolerate that. Now, we have a very, 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 I guess, important 6-week post-surgery phase. And the reason for that, with both of these procedures specifically, is that we now have got sutures inside the body, particularly with the sleeve. We now have a brand new stomach. So it functions completely differently to how it once did. So like Beck said, you've got 2 fingers, or a small ladyfinger banana, depending how big your fingers are, but you basically got a quarter of your stomach left. So, and after surgery, where we've got that suture line, it is going to be quite rigid. It's not going to want to contract or move or digest for a little while because it's healing. The good news is that with the work we do preoperatively, we get the stomach tissue to such a great consistency that it heals very well. But basically what we want to do is make sure that in the first 2 weeks when we're on fluids only, because we've got that really tight little area, or with a I guess the band, we've got a bit of swelling around where the band is. We want everything to just run straight through. So the first 6 weeks, each of the phases are very, very important. Generally, people feel really good and they think, okay, yeah, you know, I'm 4 days after surgery, I feel like I could, you know, try eating a little piece of toast. It's really important that you don't go with your gut instinct on that one. Really important that that you do work with us. I'm usually on the phone to you every week for the first 6 weeks. And the reason is that, you know, we have such a fantastic reputation here in this clinic for no leaks, no complications. And it really is because we believe so much in really guiding people through this follow-up. So basically, your stomach is not going to move at all for the first 2 weeks. Everything is just going to flow straight through. In the second 2 weeks, when we're on our puree phase, where we've got basically still very smooth, like mushed up food, but to a bit of a thicker consistency, what the stomach is going to learn to do is make very, very tiny little waves of contractions. So it's learning how to digest again. And then we have another 2 weeks of solitude where we're pretty much building pretty quickly by that stage. Your stomach's getting used to digesting. It's getting used to also how much it can fit in there at a time, and it will let you know if you've put too much in. You don't generally tend to make that mistake more than once, but you're learning so much in that first 6 weeks as well. One of the questions I had, particularly with the sleeve, because we are removing stomach tissue, is, am I going to be malnourished? Do I have enough stomach left that I'm going to absorb all of my nutrition? And we definitely do, because if we didn't, we would never ever be allowed to do a surgery like this. But it takes that commitment from you also. We see such fantastic success with sleeve surgeries, particularly with people who really grasp, okay, my relationship with food is completely different now. Food is my fuel, food is my friend, and how am I going to, nourish myself every day? So seeing food as fuel and nutrition becomes so vital in terms of you being successful and keeping all of your levels of nutrition up long term with the sleeve. And that's something that it's exciting to me as a dietitian, because it's like a big jigsaw puzzle, because sometimes it's difficult for people to drink enough fluid, get enough protein in, their B12 might go a bit low, or their calcium, and we can't just sort of put it all together in one big meal and get it down like we once could. We've got to sort of piece it all together. So I get excited doing things like that. But we can manage things, but again, it's that real teamwork effort. So it comes down to sort of you being honest and upfront with what you're struggling with. We keep a close eye on your nutrition in the form of blood tests. So I'll actually be able to see maybe what's coming down, what we're maintaining really well, and we really work to, to keep everything managed in that time as well.
How does the gastric sleeve go with post-op when you're taking medications for other medical issues you have?
Yeah, sure. Okay, so certain things after a sleeve might not be very suitable, but one of the things that we definitely need to make sure is, okay, we're only going to be able to drink so much fluid at a time. I think, within the first few days, a quarter of a cup is going to make it quite full quite quickly. So we see a lot of people who are taking sort of Webster pack, amounts of medications, handfuls of medications, and it can actually take all day to get tablets down. The good thing is that, we see so many people's medications reduce so quickly. Like I had a patient contact me who had his sleeve done about a month ago because he passed out in the supermarket because his blood pressure medication was too high. So I said, you need to go back to your GP. This is actually really important. But he wasn't expecting that to happen so quickly. And so with medications, what we do is we make sure that you really sort of talk to our surgeon, say exactly what you're taking. He'll give you an indication of what is going to be okay to take after. And the rest of the, vitamins, minerals, nutrition like that, that's what we sort of work together to factor in as well.
Can I just add to that? Was that you, Natasha? You asked that question, yeah. So sometimes they can actually convert the formula of your medication to an enteric coated capsule so that you can tolerate it more easily. So they sometimes can alter the composition. You can also break them down. You can crush them with a little bit of honey sometimes. So they do find, solutions for you. And even sometimes, if it's pain medication that's absolutely essential in those early days after surgery or those first couple of weeks, they'll find a way so that you can actually have something to keep you comfortable.
And the vast majority of medications are not going to be something that causes any contractions in the stomach, because most of them are designed to break down in certain parts of your system. So some of them will actually be tiny enough they pass straight through and they're supposed to be absorbed in your intestine. Not going to cause you any issues at all. Some of them will be broken down in the stomach. So as soon as they come into contact with that stomach acid, they actually just dissolve straight through. So it's not like swallowing like a lolly or something like that, where it sits there and doesn't do much and the stomach has to contract and move it. So most things that you are taking are going to be fine. There are only some times where we have to say, put that on hold for a little while. But any essential medication, we will always find a way that you're going to be able to comfortably take that always. Yeah, very important. Does anybody else have any questions, just in relation to food and this whole process at all? Yeah.
One question. On the band,
yeah.
to the sleeve, will you feel more hungry? Like, will your feeling of hunger all the time still be there, even though you're eating small portions on the band compared to the sleeve, because you're removing that?
Yeah, okay, no, I get what you're saying. Both of them, you will have so basically the sleeve is not really modifiable, whereas the band is. So when we got that band in that green zone that Beck talked about, which isn't so tight that you're sick and vomiting and only having half a teaspoon of food and going, yep, I'm done. And it's not so loose that you're just feeling like, oh, I feel like this isn't even there. I can eat, overeat on portions of food. We have a green zone where basically the band and the sleeve are going to feel very similar in terms of your hunger and how much you can eat at a time. I guess, a band is a really great option for people who are going to be able to maintain getting adjustments done and who feel that adjustments will be important for their lifestyle. With the sleeve, however, if excessive hunger is a real issue that has led to weight gain, or if it is an issue that really concerns people, what we have on the outside of this stomach here, it's called the fundus, are receptors for hunger hormones. And sometimes those hormones become out of balance. It's very common actually for those hormones, that hormonal stimulation, to become out of balance. When that happens, it is very difficult to resume that control. It can be done non-surgically, but what the sleeve, one of the main, points of the sleeve that makes it suitable for so many people is what it does is removes a lot of that excessive hormonal stimulation to the brain that makes you override eating what's in front of you. So a lot of the time we can sit down and have what we see as a sensible sized meal. We know we've had enough, we know we've been nourished, but sometimes when that hormonal stimulation is out of balance, we can it's almost like there's a switch in your head that says, no, keep eating more. And a lot of people find that that's something they really do struggle with, is excessive hunger. And so the sleeve is a really fantastic tool at combating some of those issues. So it really depends, all of these options are fantastic options. It really depends on what you feel, your own sort of, barriers have been to losing weight, and what you feel your own issues are, and what you feel that would help you best in your own journey. But in terms of feeling hungry with a band, we generally know if you're feeling excessive hunger that maybe it's time for an adjustment, and that we would put a bit more fluid into that band. Did the band get passed around? Would we like to have a feel of the band? Do we want to pass that one around? Sorry, I don't know if it did, but it's just still up here. So, yes.
Who, determines which is the right surgery for you? And say, for example, I've looked at and think, I really don't want anything foreign in me. I'd rather have this. But does someone determine, no, you need to have this surgery for these reasons, or
right?
We don't want you to go down this path, but you might have. My eyes patient, well, no, I don't want to do that. Who determines?
Well, I guess ultimately it's you and the surgeon who determine that. Your consultation with Dr. Ardib will be sitting down and sort of going, this is what I want to achieve. What's probably going to be my best means of doing that. The rest of us, so the psychologists, Rebecca and I, we're here to, we're here to present all of the information to you. Knowledge is power. You can never really know enough. But in terms of making any decisions, what we want to do is give you all of that information. Anything that you're looking into, I like the idea of a band, then a sleeve sort of maybe fits with what I'm struggling with more. We give you a really good education and rundown of all options that you're considering. And ultimately it comes down to you having a real good talk with our surgeon and really deciding there, what long-term, what's going to be my best solution, not only thinking of how quickly is this weight going to come off, but long-term, what do I see as my best option?
That's a question.
Yeah.
Now, what happens if you fall pregnant with any of these? What happens with that?
Okay, so
a diet,
yeah. So dietary wise, did you want to sort of touch on that as well, Felicity?
Oh, after you.
Okay, dietary wise, depending on what is there, obviously if you fall pregnant with, with Norbera, it can be very easily taken out, postponed, maybe for later on. That's not so much an issue. With the sleeve or with a band, depending on, we'd obviously be working very closely with your obstetrician, but really what becomes very important then is the nutrition that you're also taking on board for your pregnancy.
Yeah.
And I won't lie, that can actually become quite difficult. It's not impossible, because again, if something like that was going to prevent you from having children, we would never be allowed to do these surgeries. But there is a general, I guess, rule of thumb that if you're looking into having some of these procedures, there can be something again that you would decide with the surgeon, that there is usually around about a 2-year period that we would recommend not falling pregnant, but we're not always in control of these things. So it does happen. It does actually happen. People fall pregnant and they might be 6 months post-leave, 9 months, 12 months. And so really what we will do in terms of our diet is I would work very closely in communicating with the doctor who's looking after that. But that will actually influence some of our nutritional choices and changes as well. And I might just let Felicity come
Yeah,
over
no,
to that too.
absolutely. It's probably one of the most rewarding side effects or benefits that we see from patients coming through the clinic is that so often I've seen patients with polycystic ovarian syndrome, infertility issues, endometriosis, and their goal is actually to have a family.
Yeah.
And I've seen many couples come through our clinic who might have even been through 3 cycles of IVF before they get here. So the end result is absolutely fantastic. It's one of the most beautiful benefits that we get to share with our patient population. Typically, 12 months is usually, we would say, we don't want you to start thinking about falling pregnant for 12 months at least. And the benefit that you've got with having Erin here is that if that's your goal, you can identify that before you even get started. And you've got a psychologist and a dietitian who are going to help prepare you for this is what I want in 12 months' time. My husband and I want to start a family. We want to have kids. So you've got so much to get through in that 12 months, not just about weight loss, but to start setting you up for, I want to start a family.
Yeah.
So yeah, huge patient population opportunity for us.
Start a baby. I've already, I mean, I've had the 4.5-year-old, but we want to have another one.
Yeah, we see a lot of that. Sorry.
If that was going to happen, is there a preference?
For either or?
Yeah, you're like, okay, yeah, I'm at that stage now where I have to think about that.
Absolutely not. Absolutely
no
not. I'll tell you what happens. With the band, all the fluid comes out in the last trimester of pregnancy. You don't have to have all the fluid out before the last trimester unless you're suffering from severe nausea. We've got to make sure that we're not going to dislodge the band or cause a slippage because you've got excessive vomiting, in that early stage of pregnancy. But typically with the band, you actually just remove all the fluid last trimester, and then once you're ready to start getting back on track and losing weight again, you can just easily have the fluid put back into your band slowly over time.
So if you have the band, is there an increased risk of complications then if you
with pregnancy?
Yeah, if
none. The risk is actually diminished because you're going to be a much healthier person. You're going to fall pregnant more easily, and you're more likely to carry to term and have a healthy outcome. So,
and not gain as much pregnancy weight, which is which I know that kind of, but that is a real thing that can be a setback for some people. But it is something that becomes a lot more manageable with
Well,
these
you
as
just
well.
answering that just from that just made sort of my decision to think, well, if for some reason I got fallen pregnant within the sort of first sort of 8 months or something like that.
well, we're going to advise you to wait 12 months.
Yeah,
but
I know.
it doesn't. I mean, it happens.
It happens. That's what I'm saying. That
Yeah.
it's much easier then to adjust the band for nutrients
But
than it is to do.
we also see amazing outcomes. So to be honest, I've seen a lot of awesome outcomes from sleeve gastrectomy as well, and then focusing on, healthy babies.
Yeah. The only thing I ask as well, I mean, I know you're saying the 12 months and stuff like that, but I'm pushing now 42, so it's kind of, which is fine. My mum was 44 when she had her last child, so that age is not an issue.
12
but
months?
Yeah, I know.
It's 12
yeah.
months.
I'm just in my head thinking, I don't want to.
Think about what's the outcome.
And
this is something that we
I'm
have
not saying that. I'm
be a bit
saying more.
strict on it.
Yeah, I'm just saying more in the sense of you can't always be careful in falling pregnant.
100%. And that's what we've learned because we've been doing this for so long. What we actually learned was that patients would fall pregnant way too quickly, and it was often happening. We'd see a severely morbidly obese patient come through, have the sleeve gastrectomy, and within weeks they're already pregnant. So we do have to be mindful of it, and that's why we do actually have to say it, because the actual impact is very sudden, actually, in terms of what you can achieve. So.
And if something like that does happen within the first 12 months, the amount of support that you will have being in this program is going to be so tailored towards that. Not only towards the pregnancy, but towards you in that pregnancy as well. Yeah. So you will have, all of that support there, and there's nothing that we can't do to support that pregnancy. Mm-hmm. But I guess, what we generally tend to aim for is the healthiest you and then the healthiest baby.
It's one of the greatest rewards. I absolutely love it. It's probably one of the nicest things to share in patients, apart from all the other comorbid resolutions. But when you've seen, so many patients who do try IVF for 3 cycles and they've already spent $70,000, and then they come here and they have significant weight loss and fall pregnant, and it's just a miracle. How gorgeous is that? It's pretty cool.
Yes. So it's not the end of the world if you accidentally fall pregnant.
I'm not going to answer that question.
Nothing is the end of the world.
You're not going to do damage to yourself.
No.
But we'll make sure of that. But again, any of these, things that can come up along the line, it's about how you work with us also. So it's a really important teamwork, not only between us as the team, but us with you individually as well. It's a really important, teamwork. Is there anything else I can answer? Anything online or any questions anyone's got about our nutrition in relation to any of these procedures? Yes?
I've heard a few people saying that they have to take vitamins to supplement different things. Do you sort of work more on the food with natural vitamins in it, or would you be sort of saying, okay, you need to take multi, you need to take probiotic?
Yeah, okay, that's a fantastic question. That's a question dietitians really like, because what you just identified is, do you focus on food for vitamins and nutrition? And that is so spot on. Yes, absolutely we do. In saying that though, it is the surgical bariatric standard that anyone who has a band or a sleeve, and I will always say an Orbera as well, is that we go on to a high potency multivitamin ongoing. That will change obviously with your needs. Like I said, we do it. We get some blood tests, and we maintain, our nutrition by looking at what's going on there. It can be very common for women in particular to become low in vitamin D or low in iron at the early stages when they're adjusting to having a surgery done, and it's really important that we keep those levels maintained. But a multivitamin, a high potency multivitamin, is like your safety net. So basically, once you've had, probably a really important thing I should mention with the sleeve in particular, is if that's something that you look into with the sleeve, and I'm going to say the band as well, is that it becomes so important to be consistent with your nutrition. So if we miss a meal and we miss that opportunity for protein, we miss that opportunity for fluid, we can't just go and make it up at the next meal by having a bigger meal, because it doesn't work like that. Your body will say no, and it's not very pleasant. So but the thing is, we can't account for us being able to eat perfectly every single day for the rest of our lives. So what we do really recommend is a high potency, quality multivitamin ongoing. If your blood tests show me that there are no deficiencies, there's no reason clinically for you to really need anything else, then that will be generally what you stay with. But generally speaking, people, at different stages of their lives, women who might be becoming menopausal, or who have who are, having issues with menstrual cycles, might need to be on iron supplements on and off. A lot of the time during the winter, our vitamin D goes down a lot because we're not really getting sun exposure, and we can't get enough of it always from the foods in our diet. So we might be on a short-term vitamin D, vitamin B12 we might need short-term supplementation to, and they're just some of the really common examples. But we really want for you to be able to maintain your levels of nutrition and not become run down, and not have a bad experience, with your recovery and your progress through that 12 months. So you're definitely right. It's a huge combination. Your food is absolutely critical and important that we develop that positive relationship around getting nutrition out of food and really seeing food that way. But also a high potency multivitamin is definitely the recommendation and the standard as well.
we might just save questions maybe for after, if that's okay.
Yeah, that's fine.
Yep. Okay.
Thank
Lovely.
you, everyone.
Plenty of time to please do ask questions afterwards. You're more than welcome. Erin will stay around. I think probably you can get a feel for, she's got so much knowledge and so much to share, and she can chat and chat and chat for a really long time. So you will love the opportunity to get into her office, and so much to share and to learn from her. Just one of the other comorbid diseases that we see so much of is, and we touched on it briefly, sleep apnea. Is anyone aware of sleep apnea? Anyone been diagnosed with sleep apnea? Anybody sleep with a CPAP machine or hate the idea of a CPAP machine? Yeah. It's actually something that we see so much of, and to be honest, that lack of sleep, heavy snoring, poor sleep leading to poor energy during the day, that is something that we see change so quickly after surgery. I've seen actually patients get off CPAP machines at 2 weeks post-op and actually resolve their sleep apnea really quickly. That's actually the theme of next month's information evening, but just something I wanted to mention that, it's one of those things that we do see incredible results post-operatively with weight loss. It's just fantastic. So yeah, just another one of the benefits. As a team here, we love to get our patients involved in doing all sorts of active things. We're really big on trying to get you more mobile and involved in exercise. And if you've previously in another life been exercising and used to doing all those things, but you're restricted now and you can't, we're going to try and get you involved in so many different things. And we do things as a group and as a team. Might be a walk at the Gold Coast Marathon, for example. But there's all sorts of events that we tend to get our patients involved with. Also, we like to socialise a bit too and celebrate success. We recently had a dinner that we organised for patients to really focus on mindfulness eating as well. So the psychologist presented on mindful eating and what does that look like after surgery. The other thing that our dietitian Erin does is she'll take you on a supermarket tour. That is absolutely brilliant. You'd be surprised how much you can learn from walking around a supermarket with a dietitian, just label reading and different things that you might not even be aware of, hidden sugars in food. So when you're given the opportunity to join her on something like that, I would really encourage you to go along and learn. Great opportunity. All right, now we get to the exciting part of the evening. Is everybody comfortable and you're getting a feel for how things work a little bit, I hope? The exciting part meaning that we're actually really fortunate. Every single month when we host this information evening here in our clinic, we have some very generous patients who come along and willingly share their own stories. And what we encourage is that they share the good, the bad, the ugly from a patient point of view, and that you get a chance to hear what their story is, what their journey's been like. It's always different, and it's always really exciting to have that opportunity to share with you. Our first speaker tonight, Lisa, first came to us a year ago, and my strong and vivid memory at the very beginning was that Lisa was in a hurry. It was desperate and she had to have it done now, and it happened really, really quickly, and here she is 12 months later, and I actually can't visually have any recognition of how she was compared to 12 months ago. It's just absolutely phenomenal because she looks so stunning. And I really appreciate that she's driven from Brisbane tonight to share her story, so please make her feel welcome.
Thank you. I don't have a photo, but I'll pass this around and this wasn't actually at my biggest because, you just avoid cameras at that point and they don't exist. So have a look at that. So as Felicity said, I came in, actually my surgery date 12 months ago is this Saturday, so I'm celebrating. I probably came in here August last year, and what happened was I thought that weight loss surgery was for people that can't get out of their houses unless they have to be lifted by a crane. I didn't think that they were actually just for normal people who had had a lifetime of struggles, until I actually met somebody who shared their story about having the gastric sleeve, and I thought, okay, well, maybe that's what I need to really think about, or think about the band, or think about something, because I'd done everything, the cabbage diet, the master cleanse, Tony Ferguson, the Celebrity Slim, everything, just because it was a different shape, I thought it was going to be a different outcome. I hadn't always been overweight, but I'd always battled, and I'd really got to a point where I felt like I was a professional at losing weight. but I was also a gold medalist at putting it back on. So it was a constant struggle. Anyway, it got to a point where my weight got to 125 kilos. Thank you. Yeah, I got to 125 kilos. My body fat percentage was 55%, and my BMI, for any of you who know what that means, was 45. So I was morbidly obese class 3 or whatever it is. I didn't know there was different classes. And I'd contacted my doctor, and I'd gone to the doctor and got a referral, and I was all set to go to this surgeon. And then the surgeon said, oh, I don't do anybody unless you've got private health insurance. I'm like, that's fine because I've got private health insurance. And then I realised that as of the 31st of June last year, my insurance had changed because I'd moved into state. I wasn't diligent of updating my address. I wasn't covered. So I rang here after doing a Google search and saw they had a pretty snazzy website and looked at some success stories and thought, okay, this is what I need to do. I rang here and I spoke to Felicity, and I was crying on the phone because I was like, I've just had this fight with my insurance company and I can't wait another 12 months. I told them I'd be dead in 12 months. Really, I wasn't really living at that point anyway. So she said, oh, actually, well, it's your lucky day because somebody's car's broken down. So if you can get here, you know, by, I don't know, 7 o'clock or something, then you can meet the surgeon. And I was literally like on the mobile, getting the keys, getting in the car, like going, yeah, I'll be there. So I raced in and I met Dr. Adib, and he was great. And I just thought, yeah, this is what I need to do. Wasn't really sure what that would look like, but knew that the sleeve had to be for me because I couldn't be trusted with my stomach. I had to get it confiscated for life. Like that was my theory. I was like, nah, you know, I've done it over and over. I know how to lose weight, but it's always going to be the same battles. So then again, the universe aligned and somebody had to have a cancellation, and they had a surgery date on the 12th of September, which was literally only 4 weeks from the date that I had raced in here. So I think mentally I wasn't really prepared, but I knew that's what I wanted to do. So I was going on a food funeral and eating everything because I thought I'll never eat again, you know, like I won't have a stomach, and I'm going from a 2-litre bottle of Coke to like one of those little tiny like kids poppers of a stomach. And I thought, oh, this is ridiculous. Like life won't be worth living, but I'll be in a size 10 skinny jeans. So what happened then was had the surgery. I wasn't the best patient. I've got to admit that from a VLCD point of view, because I was doing the shakes and then going through Hungry Jacks and doing the shakes and, you know, but I got my liver to a point where it was healthy. I took it seriously. Dietitian was great. It was a different dietitian at the time, but they were fantastic as well. Went and had the surgery, and yeah, everything went great. Saw Dr. Adib after the surgery. Yep, all good. And then had a week off work and went back to work. Unfortunately for me, I had some complications. It wasn't a leak, so you guys still have your. But I had pancreatitis. And I didn't know that I had pancreatitis, and it was probably because I'd been having a food funeral and then just suddenly had a really like, okay, yeah, I'm going to really commit to this, and then lost a stack of weight because it's so quick, and had pancreatitis, so I was really nauseous, plus I was in pain, got really dehydrated, was in and out of hospital. They didn't really know what was wrong, then found that I had pancreatitis, and then because of the pancreatitis and the dehydration, I had blood clots in my liver, my portal vein and my spleen. At that point, I didn't know what a portal vein was. So I was like, oh, that doesn't sound good. Anyway, the thing is, I was in and out of hospital for probably about 6 weeks. Now, I'm not saying that because I want to scare you, but I'm just saying that was the reality. But on the flip side is I would still, if everything was reversed and I knew that that's what I'd had to go through, I would do that again because my life has absolutely changed. And the crazy thing is, after all that, I remember waking up and Dr. Adib was on the end of my bed in a different hospital. And I was like, oh my God, what's happened? I've gone to the other side. And he was there just to check on me because they had contacted these guys and got back to Dr. Adib that I was in hospital. And, you know, and I just thought, geez, this man has really gone above and beyond. And I think that just really shows a testament to these guys and how serious they take their patient care. Like, oh, hi, how are you? Let me fix up my hospital gown. Anyway, so I've lost 55 kilos. I lost 40 in the first 6 months. My goal was to try and lose 40 in 6 months and then 20 in the next 6 months, knowing that it would slow down and you have to make better choices and you have to be consistent. Now, I still am not a perfect patient, but I am consistent and I do take it seriously. And I think back in the day when I was so focused on, oh, I'll be happy if, and I'll be happy when, and it was all about numbers or the size that you are, really, as soon as I had the surgery, it was like brain surgery. And I felt free from having to have to think about, oh, you can't eat that because it's bad, or, you know, because I was the kind of person I couldn't have a couple of chips. I'd have like the whole bag. So I'm like, oh, well, I'll finish it because I'll start tomorrow. So at the end of the day, I've now got my BMI down to 25, which is normal. I want it to be 24.9, so my weight app says that I'm under it. And at 6 months, I flew a plane as a flying lesson because you had to be under 100 kilos to get in the little Matchbox toy plane that they put you in. And I was able to do that, which was amazing. I now dance burlesque, which is ridiculous. My body fat percentage is 32%, so I've still got a little bit of way to go. But talking about fertility, it wasn't something that was on my agenda, but I've never had periods that went in the right way because, you know, your hormones are all over the place. I was overeating, binge eating, losing weight, putting it back on, and I'm just starting to menstruate properly, which you'd think is not something to celebrate, but I'm like, oh, I'm normal. So that's really good. I certainly haven't flogged myself at the gym, but working with a psychologist, I had Warren and he was great. And I remember he said to me, don't start anything that you're not prepared to do for the rest of your life, because this 12 months is you resetting what you're going to do, how you're going to think, what you're going to eat, what that looks like. And to me, I was like, oh, I don't get it, because I'm either losing weight or putting on weight, you know? So I thought, okay, well, if my analogy was all about me being a professional person at losing weight and then the gold medalist at putting it back on, I thought if I could just do this one last marathon of losing weight and then retire from that, that would be amazing. So I really took that on board, and I'm just really more active. And I think the more weight you lose, the less sweaty you are, the more you can breathe, which is good. The less your body hurts. Like I remember I used to walk upstairs and my knees used to crack, like I could hear it all the time. So yeah, now my goals are completely different. So I'm looking at doing more training, more toning. In terms of skin, my skin, I was like reading all these stories about, you know, how to look after yourself after surgery, because, you know, I was covered in stretch marks and was thinking, I don't want to have the surgery and then have to, like, you know, have skin surgery and whatnot. But it's a reality for some people, but at the end of the day, they choose health and what the rest of the benefits come. So I just really looked after my skin and I just moisturized a lot, and it's kind of come back. But there's, you know, you can't go from being really big to being smaller and expect that you're going to have perfection. And it's just something that I'm now, you know, I've got a dog who's 3, and only on the weekend is his first time being in the water because I would never go to the beach. So that was insane. And I was actually wearing a bikini at the beach with no shorts. It was weird. I was like, oh, who am I? Yeah, so does anyone have any questions or anything about that? Yes.
Oh, just a couple. How tall are you?
168.
And
32. I turned 32 last week. Thank you. Yeah, so 12 months and my life has completely changed. And I tell you what, it's not just the weight loss and the health and all of those things that you really kind of have in your life at that point, but it's the confidence. And, you know, like I used to put up with really dysfunctional relationships and didn't have the confidence, I suppose, to go for promotions or different job changes. You know, I was just settling and that I wasn't really living. And now, so accessed my super, did it 12 months later. What I paid for from my super, I've now got in a promotion. So I'm like, geez, that was all right. Although I went and bought a convertible, so I don't know how that works. Anyway, so that's my story. So I hope that's helped. You've got a question?
I was going to ask, were you in much pain after the operation?
Oh, actually, not really. I had a lot of back pain, but I think it's because I was like tensing in in the hospital bed, but also my lower back because of the weight was always a little bit dodgy. But you know, I was up and walking. I thought I'd be like, you know, with a bell, but like walking around was much better. So it was actually surprising. Yeah, it's good. Okay.
Will you stay and answer us some questions?
Oh,
or you-
right.
Yes, awesome.
Yeah.
Lovely. Sensational story. Absolutely loved that. And yeah, the transformation's phenomenal. Benefits far outweigh any of the inconvenience. I think, you know, when you listen to a story like that, it's just incredible. Love it. All right. I also would like to call up Kirk tonight, who is a patient who's actually spoken at quite a few of our seminars. In fact, we even got him here working yesterday. Started out as almost like a little bit of a joke because we had a short staff on the desk and thought, oh, he could come and help out on the front desk and answer patient questions and talk to people when they've got a few questions about what it's like to be a sleeve patient. So we actually had him sitting behind the desk yesterday talking to people, which was absolutely awesome. And when he's got someone on the phone, he can actually really talk for a very long time. Kirk has actually had a sleeve gastrectomy over 12 months now.
Yeah, coming up to 2 years this December.
Yeah, 80 kilos of weight loss. Can you believe that? Look at that, and can you actually imagine? It's pretty amazing. But a couple of the questions that I wanted to ask Kirk tonight are really going to just relate back to the theme of what we wanted to focus on tonight, being about you know, being able to play with your kids. And if you see the image that we had on our Facebook page, I think Kirk really epitomises that image of someone who probably didn't actually get up and participate and actively play with his kids beforehand. Is that right?
Yeah,
So can we talk about what you're actually able to do with your kids and how that's changed for you?
Well, when I was 107 kilos to start with. I'm down to 90, roughly. Bounces a couple of kilos here and there. Yeah, I'd be sort of just that lazy and big. I just sit around watching TV and not want to go outside with the kids and play. But since I've had the sleeve and I've lost all the weight, we're always outside playing and mucking around in the pool and getting out with them and doing stuff with them, not just sitting around and saying, you know, just go outside and play, let them work on their own sort of thing. So.
And I think that relationship, that changes the whole dynamic of your own relationship with your family and with your kids, you know, and how your kids actually perceive you, you know. You want, isn't that what you really want to see them, for them to see you being part of and engaging in what they're doing? It's such an incredible change. What about theme parks, things like that?
Yeah, theme parks, I used to call it the walk of shame. You'd get on a ride and that little flashing light wouldn't stop flashing for the harness. You know, it was always, just wouldn't do that last click and you'd have to walk off the ride and, you know, your kids would want to go on you with you, and so they'd come off because they were scared. They wanted you on there, so you're sort of letting them down as well. So now, you know, we sort of got, as soon as I could fit on them all, we went down there and we rode all the rides they wanted to ride, and they were happy as well, so it was good. You don't have to do the walk of shame anymore, getting off those rides in front of, you know, hundreds of people you don't know. Yeah.
What other kind of lifestyle changes have you noticed most significantly? What are the most important things that you've changed in your life?
Oh, just my eating habits. We don't do takeout. Well, I don't, hardly ever. And the kids, because we're all eating healthy now, sort of my eating's gone to the rest of the family. The kids are eating healthier. We're not getting them takeout all the time because we couldn't be bothered cooking. Just, yeah, all sort of help, not just help me, it's help my family. You know, not that my kids are big or anything, but they could have potentially led to where I was just from all the easy takeout you can get now. And
they're now healthier.
So,
and your wife too. So
yeah,
it's rubbed off on Kirk's wife Tanya, who now also goes to the gym.
Yeah.
She's turned into a bit of a gym junkie.
Yeah.
And focused on, you know, as a family on health altogether.
Yeah, we see a PT, me and my wife, about 3 times a fortnight now together. So we do that. And yeah, so we enjoy doing that.
I suppose you'll save a bit of money, you know, or probably a lot of money, with not buying the amount of food that you used to.
Well, absolutely. It's not just the food bill that changes, but one of the points that Lisa raised in terms of financial health and well-being, it's something that people don't actually think about. And I think that does have a lot to do with, number one, self-confidence and going after that promotion. But that's something that I hadn't heard patients talk about for many years. And then all of a sudden I had patients tell me, well, actually I've caught up, you know, not just the amount of super that I've claimed to actually access my surgery, but my whole financial health and well-being's changed. And I think of one of my patients who actually had a gastric band in about 2004. She was she was about 212 kilos when she had a gastric band. One of the greatest successes I could ever sort of really think about with gastric banding. And she actually wouldn't do anything physical at all. She sat behind a sewing machine. That was her comfort zone, and she wouldn't get up from behind it unless it was to go to the ironing board. And then all of a sudden, with weight loss, she's actually now working in the mining sector and managing camps in places where she would never have even set foot before. She's property owner and doing so much more with her life. And I can see the financial health and well-being as a consequence, and what an amazing benefit, to even see that at such a short, even, 12 months down the track, such a great benefit. But yeah, your food bill, be really interesting. There's all sorts of information on the weight loss calculator, how much a patient spent on not just diets, but gyms, and all the other programs over time cumulatively, and compare that with the costs that you're investing in surgery. And I know that often cost is one of the biggest barriers. It's one of the first questions before even finding out what are the benefits and am I a candidate. It's frequently, how much is it? Well, how much are you going to save and what are you going to gain? So actually having a different vision of what that investment's all about too. Has your food bill changed?
Yeah, it went down heaps to start with.
Really?
Yeah, when we first started.
Yeah.
And then even going out now to restaurants, we still enjoy going out to restaurants, but I might just order an entree now. And that's me sort of thing done. And if I don't feel like anything that's on the menu, I just let everyone else order. Then I just walk around with all my kids and pick off their plates and I'm done anyway. So,
have you been overweight for a long time? Or?
Yeah, I was pretty much overweight all my life. I was always around, as an adult, around 120 kilos. And then just when I got remarried, just, you get happy and just get lazy and settle down and sort of thing and just go away. But someone said to me, why do you want to touch your super? What are you going to do when you retire? And I'm like, if I don't touch it, I don't get healthy. I'm going to be dead and I'm not going to see my super anyway. So I might as well touch some of it while I can. So it's sort of everything,
Is that a question we have to ask later? Like, how much super do we have to go into, or the cost?
Yeah, more than happy to answer that question. If you're self-funding entirely and you're accessing super, typically we'll be putting in a request for about $24,000. I mean, that's more than adequate, but we there's no hidden extras. We include absolutely everything, right down to the barium swallow and the radiology department's tests that are going to be ordered for you 2 days after surgery, so that we don't miss anything. Our distance patients also, we include travel and accommodation expenses for them, if they're financially, if they really need that, so that they can pay to have their surgery. I've got a family from Rockhampton already planning their surgery for January, but we're able to add in the amount for travel and accommodation as well. So, it's really flexible and it does give us the opportunity to help people. Yeah.
With alcohol,
that's the next question I was going to ask you. Go for
it.
Like,
not that I'm a big drinker, but sometimes I don't mind to drink. Do you notice that you obviously can't drink as much regardless of what procedure that you have?
Yeah, I had to sleep, obviously, yes. Yeah. My alcohol content, because I'm a shift worker.
You work from home?
Oh, yeah, as you know. So, our days off might be Tuesday, Wednesday, so that's our weekend. So Tuesday afternoon, the bottle of scotch would come out, and by 9 o'clock that night, there'd be probably that much left. And that'd be my binge drink. And that'd be not every week, but it might be once a fortnight or once a month. So now I don't really drink Scotch and Coke made myself because the Coke's too fizzy. It just doesn't sit in my right. If I do have one when I go to the pub, it's usually one and that's it. But I can drink the Johnny Walker pre-made stubbies. They're less gassy, but a big night on them's 4 stubbies. I'm not drunk. I'm just satisfied. I've had enough. I haven't been drunk. My opinion, in my experiences, I haven't been drunk yet.
So after surgery, how long would it be before, if you had a glass of wine or something like that? How long?
Probably not within the first 6 weeks when you're on a very restricted diet. I'm sure the diet.
Liquid though.
Yeah.
We all say that.
We don't recommend blending the powder from the shakes with alcohol. I've never heard that before.
You'll find things like I used to love milk. I could go at 8 o'clock at night, get a mug, nearly a litre of milk and just drink it. I can't now. Milk just sits funny with me.
Okay.
Sometimes fatty foods too. I
fatty
know a lot of
foods.
patients say that they're not comfortable with fatty foods.
That's a good
Which
thing.
it's
isn't
all
it?
they're all positive side effects.
KFC story.
So, do you ever get back to a standard meal size once you've had the sleep, or not at all?
No, you're on a restricted portion. It's more like an entree size plate. You're never going to, if you were to try and overeat and eat what you might call as a normal size portion for you now, you would risk that kind of dilatation of the stomach, and you're going to learn and be educated by the dietitian on how to eat well, what size portions to eat, and how regularly to eat, which are all going to really have advantageous outcomes from how your metabolism functions and lots of things, but she'll teach you all about that. So yeah, definitely smaller portions. If you're someone who has 3 big meals a day, it's not going to look like that anymore. It's much more reduced. The holding capacity of the stomach is so much less, and all bariatric procedures act on satiety. So you're going to feel full. You actually are not going to want to eat and push yourself to actually eat over the limit of the capacity of your stomach.
So if you do accidentally eat more than what you should, what are like the side effects?
You won't do it too often because it hurts.
Oh, really?
It is. It's like it's not even like a full pain. It's just a bad pain.
Oh, really?
And then you sort of go for a walk to the toilet. Because the only way to fix it usually is to get rid of what you just put in. If that's too much, that's how me and my wife and how I've had to deal with it. It's that first 6 months when you do start eating solids is what your learning curve of,
Yeah.
okay, that was too much.
Everybody's going to push the boundaries once with any procedure. It might even be that one spoonful too much, but typically you'll hear that most patients will report to the dietitian that they've just tried, just a little bit too much and it was uncomfortable. But once you've done it once, you're typically not going to do it again. Is that right? Is that fair?
Yes, that's correct. Because it hurts. So it's, and like I said, I've sat there I've had the 1 or 2 too much and thought, oh, it'll pass, and it doesn't. The only way to get rid of it is to go and get rid of it yourself. But once it's gone, it's good. But you learn, you think, you will learn your portion sizes and what you can and can't eat now. Like bread's no good for me.
No bread at all?
Well, I do have garlic bread occasionally when I'm out.
Yeah.
Toast is all right. It's just that doughy, soft bread. When it hits your stomach,
Even
it just...
grain bread?
Oh, I haven't tried grain bread. I tried one bit of white bread once and it wasn't nice, so...
He tried cottage cheese for the first time yesterday, so...
Yeah. I'm still learning on, had cottage cheese. I love salmon now. I never would have touched salmon before.
Yeah.
So, there's things I used to love that I can't have, and there's things I've never tried that I love. So, your whole eating changes. It's...
Food cravings change.
Yeah. And you don't get the cravings you're sitting there going, oh, I feel like that. You don't really get that anymore. Half the time you got to remind yourself to eat, which is, I think, is a good thing. And sitting there dwelling on what you can go and eat. Yeah.
A lot of patients will say that SnapLock bags become their best friends because you've got to be more organised. And especially shift workers too, you've got to plan so that you're maintaining good energy throughout the day. Your day might be a little bit different to everybody else's. So, having a few nuts in a SnapLock bag or half a muesli bar or whatever it might be so that you can always replenish and have something to give you that energy.
So you're more inclined to graze once you've had this procedure? Is that a better way to
Yeah,
eat?
it's eating more times a day.
Regular.
Which, more often than having just 3 meals a day, which probably not supposed to do anyway, I don't think, are we? In general, you just have smaller meals more often to keep yourself satisfied and keep your energy levels up.
Which is why it's probably so effective on treatment of metabolic disease and resolution of diabetes as well, because you're increasing the metabolic function. We actually also engage with an exercise physiologist at certain stages for some of our procedures. So it's something that we can offer to all patients. If you were plateauing, for example, with your weight loss, or typically after the removal of a balloon, then the dietitian will work with an exercise physiologist for you to have metabolic testing, so that can actually help her to be more prescriptive as well around your specific individual needs.
Okay, congratulations.
Thank you.
With losing so much, what did you do for excess skin?
I haven't done anything. Well, except for gym now, just trying to bulk up
Just
the
looking after
muscles. Sorry if you don't want to see them, but there's a little bit there on my arms.
Yeah.
But if I sort of
Yeah.
tense up, you don't really see it now.
Not bad for 80 kilos of weight loss.
Yeah.
I've got a little bit of
So I thought there must
little
be.
bit of a, yeah, there is here a little bit, but it's not too noticeable with the belt and jeans, and it's not too bad in shorts or whatever either, but just, there's a little bit there, it's nothing major, I don't think, like, I'm trying to work on that with the PT too, to see if I can get it better myself, sort of thing.
How many procedures would you do through the week?
Every week? Sleeves, maybe 10.
What's the most popular? Is it the sleeves?
The sleeve. Sleeve is definitely the most popular procedure of choice at this point in our, in terms of where bariatric surgery is, and you know, I guess, you know, there's so much information out there. One thing, on the one hand, it's a good thing, but also what I would say is be careful of being too attached to what other people say on forums and blogs and things like that. It's great to be connected, and we actually do offer support via our own Facebook page and other areas of social media support. But yeah, just be really careful that you need to be guided by a team of professionals to suit your individual needs, both before, during and after surgery. You know, take it on board when you're chatting online, but just be very mindful that that's not where we want you to be educated, and it's not where we want you to take on popular belief, because there's some really poor discussion
I
going
stopped
on.
actually being part of one of those groups because I thought, hang on, I don't really want to know. I
It
would
can
rather,
be a bit too negative.
yeah, it was
Yeah.
very negative, and
Yeah.
and I thought,
So-
well, that's
Healthy.
their experience, not someone else. 'Cause
Correct.
Even when I've spoken, well, how I got it was a lady that came to my house to do my makeup for my wedding, and she'd said that she was bigger than me, and this is what she had done, and that's how I found out the information. And having been speaking to other people, like, you know, thinking that this is what I'm going to do, I was like, oh no, my friend had a bad experience. But again, like, is it Lisa?
Yeah.
They were saying that, you know, everyone, you know, she had a bad experience, but she
Hers was an exceptionally bad
That's right.
experience, and out of the box, like totally a 1 in 500 kind of experience that you just don't see.
like I said, you would have done it all again anyway. because
Yeah,
of what
I think it's
come-
actually really exciting to be able to present that to a group of patients here and now, to actually say, you know, it's real and it can happen, but it's very, very rare. And, you know, I think the important thing with any complication is making sure that you've got the skill set of the team to manage it no matter what. You know, if it's a balloon and you've got a lot of nausea and vomiting, who can you talk to make sure that that's normal, as opposed to also, you know, if there was to be something really serious, that you've got someone who's going to be able to fix it for you no matter what.
And I just want to say thank you, really what you said tonight just really resonated with me, with the whole dieting and all that sort of stuff.
Yeah.
Well, since my operation, there's been 12 to 14 people that I know of, whether at work or home, private life, that have had the sleeve.
Yes, it's
And
I'm
amazing
really
advocate.
surprised of it when I've mentioned it to people.
Yeah.
Oh, yeah, we've had 4 ladies at work do that. I was at the hospital the other day, and they said, you know, one got the band and 2 got the sleeve and all this sort of stuff.
Amazing. Kirk's
yeah.
influenced a whole workspace, and it actually be fascinating to find out amongst his colleagues and those who he's actively supported and encouraged, and that have come to have their surgery because of him. Be interesting to look at how much weight as a group they've all
And they come
lost.
here.
Yeah.
Oh, that's what I was getting at.
Yeah.
With
Yeah,
the
most
with
nearly all
the
of them.
most of them have. A couple have gone elsewhere, but it's amazing the after treatment that everyone that's come here is receiving, compared to just going to a doctor and he says, sort of, see you later. You know, you can ring up the girls here, or Warren, the girl obviously, but bring up the anytime in the 12, you know, after, and they'll speak to you. Where, you know, the other guys who don't have those checkups every 3 months, they don't have them scheduled in. They don't get phone calls to see how they're going, you know, like Aaron does. So
And my husband works with
Okay.
Kirk,
Yeah.
and he's been telling me how all these people have had it, how amazing they are, especially how
It's-
good the women look that have just recently had it. So he was all for me.
Yeah, oh, it's incredible. Yeah, quite an amazing workplace. That's quite unique to see that, you know, maybe about a dozen within that one space have totally transformed their lives.
Yeah. And when you decided to have it, did you have in mind what you wanted, or were you open-minded
Yep.
and is that what you wanted? Okay.
my mum had the operation back in 2012, the
Yeah.
sleeve.
Yeah.
And
Oh,
didn't your mum have the,
no, she had the
oh,
sleeve.
she had the
Yeah,
sleeve?
she had the sleeve. It's been that long.
Okay.
She had the sleeve, she lost 50 kilos. And I got
Wow.
to that point where I went, oh, I probably should do something. I said,
Yeah.
I'm not having a major operation.
Yeah.
No way in the world. I'm having a light band.
Yeah.
Walked in here and spoke to Dr. Adib. He said, sleeve.
Okay.
Not like that, but you know
Yeah.
what I mean? We spoke about it, obviously. And obviously by the end of the session, it was my decision then.
Mm.
You know, well, that's
It would have
probably
been
not going to do. I'd probably still be 150 kilos today if I went to the band. So I was just scared of dying. I mean, nothing before. You know,
It's a pretty good motivator.
never had, yeah, you know.
And the majority of people at work, what have they had? Have they had
Sleep.
We've all had to
Sleep.
sleep.
They've all had sleep. Yeah. And it is interesting, you know, the motivators for people are all different, you know. I mean, for Kirk, you know, having that thought that it's a life-saving procedure is amazing, but, you know, everybody's different.
I'm not a smoker, but do you find changes with smokers after they've had?
Well, we try and get them to stop.
Do they? Or,
Some actually do. I've seen some patients who've been smokers who've given up the day they've had their sleeves and they've never gone back to it. Others who, you know, we've actively supported to actually make sure that, you know, you're doing this for your health and for the rest of your life. We don't want you to actually stay a smoker. What are we going to do about that? And that's just part of the holistic vision that we would have treating a whole patient. So we do offer some solutions there as well.
So you've been going for nearly 2 years now. Do you still need support at the clinic or?
Yeah, he does.
Yeah. Well, I'm always here, so I've got the
No.
support anyway. But not as in I don't need them. You know, I still speak to Aaron about food choices and stuff, but that's just still getting around. You know, you think something's healthy, and you eat it, and you feel like crap, and you go, "Why did that happen?" And Aaron will tell me why, and I'm like, "Oh, cool. Okay, I won't do that again."
I guess it's more about knowing that you can always come back. You've
Yeah.
always got someone to talk to. There's no finite end to the support that's offered. We've got band patients 14 years, 15 years later still coming here. So it doesn't have to be a finite 12 years, you know, 12 months and goodbye situation. Yeah. All right, thank you. Kirk will stay and answer questions. Lisa's here, our team are here. If you've got any questions, now is your opportunity to have that time to ask them. Thank you all very much for coming. It's been a pleasure to have you here tonight. And thank you to our team and our awesome patients for sharing their stories. Kelly and I are here if you want to talk to about appointments or what happens next. We're very happy to help you here and now while you're here with us. Thank you all very much and look forward to sharing your journeys with you.